So good morning. I'm here with two of my friends and colleagues who are holding it down here in the South, really around HIV criminalization, and really just really great work just happening across the South as it relates to all HIV related issues. But today I wanted to just hop on with the two of you to talk a little bit about HIV criminalization and COVID-19. And so I'll let each of you introduce yourselves, and then we're just going to have a conversation about, what we're seeing and what's happening here in the South, and what a lot of those intersections look like. So Linda, I'll toss it over to you for a quick introduction.
My name is Linda Dixon. I'm the Health Law Director and Attorney at the Mississippi Center for Justice in Jackson, Mississippi. And I'm very happy to be on the call with you all today.
And Mandisa?
Oh, okay. Hi, I'm Mandisa Moore-O'Neal. I'm the founder of the Moore-O'Neal Law Group of Black feminist law and policy practice. And I'm also the litigation director at Frontline Legal Services, based in New Orleans and doing work across the whole state of Louisiana.
All right.
And my pronouns are she, her, sorry.
Thank you, Mandisa. So I'm Eric Paulk. I am the deputy director at Georgia Equality. We are a statewide policy and advocacy organization focused on LGBTQ issues, but also on communities of people who are living with HIV. And so let's just sort of hop into it then, and really talk about, what we're seeing as it relates to HIV criminalization and COVID-19, how those two things are kind of intersecting with each other and what we're kind of learning just sort of as practitioners, as Black lawyers who are on the ground. What are y'all seeing?
Well, I think the most prominent thing is the racial inequity piece and the health disparities. We always knew they were there. We know they're there and it exists. And for it to be some phenomenon that Black people are not only the highest cases of COVID, but in death as well. So I think it just highlights what we know has already been there. So that's been the most, thing that stood out for me.
Yes, I totally see that as well. It mirrors what I remember happening after Hurricane Katrina in the narrative. For a very small time period, it was a lot of shock and dismay. Why is the government, letting people, why is this happening? Then what did we see in the media? This narrative of looters, this narrative of Black people who chose to stay. And suddenly, what did you see? This shift from, oh my gosh, what's happening, to they don't deserve to be saved. We're seeing that same thing with COVID in terms of, at first, his data is sort of just coming in and we're not sure what's happening. We're in this together, right? It's this narrative of we all have to do these things. Once those numbers came in and what we already knew was made clear with data, suddenly things have to open back up, and the Beckys and the Karens begin protesting, not that they need to go back to work, but that we need to return to the workforce for them. No one was saying, I want to be able to return to my job. They were saying, I want you to come back and work as my hairdresser and serve my food and do my nails.
And that's interesting, a really interesting point, because, who's heard of the term essential worker? That's some new stuff, right? New stuff. So essential worker, frontline worker, we know who the essential workers are. Yes. The essential workers are, Black folk who are showing up to serve everyone. And, how are they being protected? What's happening to protect the essential workers that are going back to work in grocery stores and work in restaurants. And we know what they look like, right? Yeah. So that has really, I think, broadened the dynamic in terms of just how this has bordered on race.
Yeah. And I mean, just to add to that, I think, the fact that people have not wanted to talk about race, which is one of the things that we also see sort of in the HIV space and the HIV criminalization space. And so, we use a lot of race neutral language when, it's Black people who are most impacted by HIV, Black people who are most impacted and have interactions with the criminal justice system, and, is Black people who are being prosecuted under these laws. In Georgia, 62% of the folks who are arrested are Black folks. And so for us to be having conversations, whether it be about COVID-19 or about HIV criminalization, and for race not to be like at the top of the list for where the conversation starts, I think is very dishonest.
I totally agree. And to me, like historically and currently, there has never been a conversation on criminalization that did not impact Black people. Like if we're talking about, like I know in a lot of Southern states, ours included, especially last year, it was all of these anti-abortion bills introduced, mostly passed and signed into law. That's a criminalization conversation that needs to have Black people. And it's like, there's no example of criminalization that's not already having an impact and stands to further impact our community. And that's one of the things that I see, like this paradigm that we're in terms of, we see examples of people wearing masks, Black people wearing masks being criminalized. We see examples of Black people not wearing masks and being criminalized. So it's very clear that the conversation is not about public health, because how is it in the interest of public health to have 5 officers tackling somebody not wearing a mask if it's really about contagion and containing and flattening a curve? We see how once again, public health is being used as this kind of framework to really increase the policing of our communities and the surveillance. Because one thing that I've been super concerned about is these conversations around facial recognition in service to COVID. Advocates, we're like, absolutely not. We know that, law enforcement has been trying to increase that across the board. So I think it's an opportunity to also be very wary of how public health language gets used to actually increase surveillance and police. Like that's another area where I see some ways to really make the connections and to also intervene, because how many times have we heard this narrative of public health being the reason why these things that are harmful are sold to us as good for us?
Right.
I agree with you. Like the contact tracing and the surveillance, we have to look at that. That's scary. We have to look at the systemic systems, the issues that can, as a result of that, and what really can happen with that information and how it plays out when we know that the majority of people that's been impacted by COVID has been African Americans. I know here in Mississippi, our most recent numbers reflect that 59% of Black people are the cases. We have 59%, and in white is 31.7%. Black people in Mississippi make up 37% of the population.
Right.
So just those numbers in itself, and when you look at, of course, the health disparities, and you add in the social determinants of health and criminalization just across the board, not just even with HIV, it's we need to be proactive.
Yeah, and I just add to that, also when we talk about sort of, the public health framework, we don't address the fact that, as an institution, the public health framework is also racist and biased to Black people. And so, that's another sort of like layer, to kind of put into this conversation. And so I'm sure y'all have heard about, folks having to wear ankle bracelets in Kentucky, I think in Alabama and in Massachusetts. They're allowing people, they're reporting to police officers and to EMTs whether a person's COVID-19 status, saying that will, help those workers protect themselves. But there are huge privacy, rights issues that play into that. So can y'all talk a little bit about, where privacy comes in with COVID-19 and also with HIV criminalization laws?
Yeah, I can start. One of the things that I was thinking about in terms of public health is we're seeing the connection of the origins of public health and employment, like in terms of what we know as the public health model. It really comes from employers, owners, the top, 1% needing, demanding of the state to have a minimal health infrastructure to assure their workers were healthy enough to work for them. It was never about wellness of workers. It was about, I need you to be well enough to come and make me money. And that's what we're seeing right now in terms of of workers saying, I'm scared, I'm fearful, and employers, and the 1% being like, it doesn't matter, you come back, and I'm cutting off unemployment. And to me, that, desperation is one of the things that we are seeing people have to give up. I have to give seeing people have to compromise. That's where I see these conversations, as far as the connections to privacy, we're being told we must give things up in order to be well. We're being told that what we thought we had is no longer in the interest of someone else's public good. That's something that I see, and it is, and again, I am disturbed by, especially in terms of what this means for health information. I was very disturbed in terms of states being encouraged to essentially issue public health emergencies, which meant that certain laws that had been in place before are now temporarily suspended. And the implications of that on people's privacy rights is disturbing. And I don't know when we'll see the end of that. And I don't even know if we've seen the full implications of that.
Yeah, and you touched on this, but I think we surely have to acknowledge the health infrastructure and what's lacking there. The United States of America should be flooded with PPEs, of course, for the frontline workers, where they don't have to reuse, because that's cross-contamination. I'm not a scientist, but, and for communities, we expect communities to understand that they should wear a mask to help decrease the risk and the spread of COVID, but how are we getting it out there? That's a way we could use our federal dollars and I want to say, even I know in some places they've brought in military help to get this out to communities who don't have access. You can't tell someone wear a mask and they don't have a mask. I would know we can do makeshift things, but how do we get this information out there to the communities who need it the most, who don't have access to the internet or you can't tell somebody to wash their hands for 20 seconds if they don't have soap and running water.
Tell people stay at home. They're experiencing homelessness.
Exactly, and that's real. I mean, that's just.
Yeah, and I mean, the unemployment rate, right? And so,
yeah,
as more folks are becoming unemployed, then they're also becoming more vulnerable to everything else.
And they're uninsured. So you have a lot of people who have access to health care, health insurance to their employers. Yes. So if they're not employed, and if they have a family and children, that means their children. So you have families who are at risk. And testing is a concern too. It's, widespread testing, especially, and I know they've been going into communities who have hotspots, and now they're relaxing the testing for, anyone who wants to be tested or who's been around. So they've extended that some. So I was happy to see that.
Yeah, in a state that didn't expand Medicaid, it's really hard to expect for people to stay healthy, and protect themselves when, again, there's not an infrastructure in place for them to really be able to do that. We've seen a lot of stays on eviction, but, the conversation that folks are not having is, once the stay is over, you're going to be responsible for the rent and arrearage.
Mm-hmm.
Right.
So,
Right.
Well, I would just offer it's an act of violence. And, that's not a word that I use lightly or use loosely, like as somebody who started doing a political work, like in the radical anti-violence movement. Like it's a word I'm using intentionally. Like if our governments were partners, we would say that is abusive to withhold resources and then hold you responsible for not having those resources. Like we would say that is an act of violence. Our governments are doing that at the federal level, at the state level, and oftentimes at the municipal level. Therefore, to me, it feels important to name this as like acts of economic violence. In terms of a few weeks ago, I wrote an article in The Body kind of touching on this issue of if it's really about flattening the curve, there are things like concrete things that are very easy to do. Because like you said, yes, in Louisiana, evictions are suspended, but rent freezes are not in place, which means that, like you said, once it's a time like to have them start up, you have to pay April, May, June, plus, what's next? July, so
and people
what are people supposed to do? And I also want to just highlight right now that I'm very excited that in New Orleans, our sanitation workers are in their third week of a historic strike. These are men who are on the front lines picking up trash daily, have not been offered or provided hazard pay, have not been, given PPE, and have not received any kind of a raise. That's a multi-million contract that our city has with them. So I also want to highlight there are people who are striking right now. So I just want to highlight, these amazing workers, men, fathers, family members, Black people who are already at higher risk for COVID, who are striking, who are entering, who have finished their third week. I also want to highlight that there is a coffee shop in the Garden District that is on strike as well, still perking, because they too have been told by their employer, who received PPE loan money, that they have to return to work, and there has been no promise or guarantee of safer conditions. So I also want to highlight like folks who see the contradiction and are responding to in ways that are admirable.
And that's commendable of them, because they're losing money every day that they can't take care of their families, right? And we already pointed out that, yes, evictions may be at a stay, but you still have to pay for your rent or your mortgage for the times that for the months that have passed. So it's going to be hard for families to catch up. I mean, and folks were already, some people already living paycheck to paycheck or however. I mean, that's reality, you know. And to make it seem like it's somebody's fault, I think is just severely disingenuous of all that's going on in this time. I mean, this is truly a pandemic, and it transcends across so many different areas: economics, housing, you know, criminalization, you know, and already crumbling health infrastructure in a lot of places, especially rural areas. I know in Mississippi, about 55 or 56% of Mississippians live in rural parts of the state. So, you know, we know that after the Affordable Care Act and trying to build on that, especially for states that didn't expand Medicaid like Mississippi, we know that there's been hospital closures. So, you know, we're expecting something out of nothing.
Yeah, I mean, you know, my family is all in rural South Georgia. So, you know, just the impact, you know, Albany, I'm sure that y'all heard about, was, you know, one of the hot zones, you know, in the state. And so just for folks who are in rural areas, it all becomes like super heightened. So any sort of last words as just sort of, you know, Black lawyers who are working in this space in Southern states, what are just sort of your sort of like final thoughts that you would want to share with folks?
You know, I first of all, this has been a wonderful conversation and one that I think we need to continue. So that's going to be my final thoughts, that we continue to analyze the data, make sure that discriminatory practices are not happening, and you know, keeping that conversation going.
Also, first I want to just say thank you to my colleagues, folks who I admire and have admired for a very long time. I think I want to just end with that, like, our role as Black people who have personal experiences, lived experiences with white supremacist, heteropatriarchal capitalism, and have this skill set. It is our job to continue to point out the inability of the state to solve the problems it has created, you know, and to introduce viable alternatives that keep our people safe.
Absolutely. You know, I love working with both of you, you know, and it's only a handful of us, you know, Black lawyers who are doing this work. And so, you know, I just really, you know, appreciate the both of you and always being, you know, partners in this work. You know, for us, you know, it's never just about, you know, the legal work. It's all the other stuff that comes and intersects with it. And so, you know, our work is HIV and HIV criminalization, but we take all the other parts and bring all that to the table too, to make sure that communities have everything that they need and are well equipped. And so I just thank y'all and love all y'all on board today. And just thanks for this conversation. I'm sure we'll be doing more of this. And y'all have a good Saturday.
Thank you.
Okay. Thank you, Counter Narrative Project, as well, for gathering us.